Hello all, this is Dr. Alsip, and we're talking about one of my favorite areas of the lower limb, and that is the muscles of the thigh. You have three compartments, muscle compartments, that are divided by fascial plane. So you basically have these muscle compartments with similar actions as well as similar innervation. So we're going to talk about those three compartments and some of the specifics within. All right, so you can see how we have an anterior, a medial, and a posterior compartment when we're talking about the thigh region. So let's start with the anterior compartment. And this is going to be predominantly composed of one muscle, which is called the quadriceps femoris. But there are some other muscles here that are both powerful or very prominent in terms of being able to locate it and help with identification. And so this first muscle that we have here is very powerful, but it's kind of hidden. You can't really see it very well. You can see it kind of coming together, but when you're actually in the anterior compartment of the thigh, it's going to kind of dive fairly deep to go insert on this lesser trochanter right here. And this is the iliopsoas muscle. This is actually composed of kind of two muscles that are located more in the abdominal pelvic region that come together with this common tendon to the lesser trochanter, and that would be the psoas major, which you can see here, and the iliacus muscle. So they kind of come together for this common tendon to the lesser trochanter, and when this contracts, it can play a role in terms of kind of flexion of the trunk, but it's a very powerful and kind of the main flexor of the hip joint. So when it contracts, it will cause flexion of the hip joint. This next muscle, sartorius, I have in here not because it's a powerful muscle. In fact, it's a very not powerful muscle. It's very much a synergistic muscle. But when you're looking at the anterior thigh, it's hard to miss it because it's kind of right. It's the most superficial muscle in the anterior thigh, and this is the sartorius muscle. Sometimes you hear it referred to as the Taylor's muscle. You kind of, Taylors would often sit kind of in a cross-legged position. So the sartorius will play a role, a very small role in terms of the actions that allow you to get into that position. So you would have hip flexion, even knee flexion, abduction and lateral rotation of the hip joint. It will play a role in terms of all those actions, but very much in a synergistic component. Say that the major muscles that play a role in terms of those actions were to become deinnervated and not functioning, sartorius really can't take it up in order for you to get to those powerful movements. It also has the distinction of being the longest muscle of the body. So it's starting way up here on the coxal bone, and then it will have its distal attachment on the tibia. All right, here's the big one in the anterior compartment, and that is the quadriceps femoris. Often you hear this referred to as the quads. And this is called this because there are four different heads, and these muscles are so large that they're often just described as four different muscles that come together for this common tendon down here. So recall, you have that quadriceps tendon that is going to extend all the way down to the tibial tuberosity. So once you get past the patella, it's called the patellar ligament. And so the four parts are going to be the rectus femoris, which is the one that runs right down the middle. Rectus means straight. Then you'll have the vastus medialis, the vastus lateralis, which is a really powerful component of it. And then deep to the rectus femoris would be the vastus intermedius. And again, these muscles will have their distal attachment on the tibial tuberosity of the tibia. These muscles are innervated by the femoral nerve. All right, so the femoral nerve is not a branch of the sciatic nerve. A lot of the muscles of the lower limb are going to be innervated by the sciatic nerve. This is not one of those examples. It's going to have a very unique innervation with the femoral nerve. And the powerful or the main movement of the quadriceps muscles is going to be extension of the knee joint. All four of these heads will play a role in that. The rectus femoris actually will cross the hip joint as well and can play a role in terms of flexion of the hip joint. But really what I want you to focus on here is that the quads will extend the knee. All right, moving to the medial compartment of the thigh. These are generally located a little bit on the deeper portion, but you can still see it from an anterior view. You can also see some of these muscles from a posterior view as well. And oftentimes this compartment is sometimes just referred to as the adductor compartment, because these muscles' main role is going to be adduction or adduction of the hip joint. So you will literally have three muscles that have adductor in its name. You'll have the adductor longus and brevis, and then you'll have the adductor magnus, which, as its name would suggest, is quite large, but generally you can actually see it a little bit better from a posterior view. You'll also have a muscle that's going to kind of skirt along the most medial, actually the most medial of the medial compartment, and this is the gracilis muscle. It is not a particularly powerful muscle, but it is considered part of this group. And most of these muscles will have a distal attachment on that linea aspera that we talked about, which is going to be on the posterior side of the body of the femur. Now, you may have heard of a groin pull before. It's not necessarily a pull of any of like the erectile bodies or the external genitalia. It's generally going to be a pull or a tearing or a strain of some of those proximal attachments of the muscles of the anterior medial thigh region. A lot of times those adductor muscles are going to be the portions that are going to be torn, but you can have some of the deeper muscles associated with the anterior compartment. You can see that here. Anytime you have this glowing red, you know something's up. And so that's what's going on here. You have a pulled adductor longus muscle, which would be colloquially referred to as a groin pull. All right, last but not least, we have the posterior compartment of the thigh, and these are referred to colloquially as the hamstrings. So the hammies in the back of the thigh, these are going to be a collection of three very long, very rope-like type muscles. You're going to have the lateral biceps femoris, biceps indicating that there are two heads associated with it, but generally you only see the one head pretty well, the other one is deeper. And then on the medial side, you'll have the semimembranosus and the semitendinosus. The semitendinosus tends to be the more superficial of the two. These three muscles will have their proximal attachment up on the ischial tuberosity that we talked about, your sit bones up there. So that is where these hamstrings are going to have their proximal attachment. Their distal attachments will either be the fibula on the lateral side or the tibia on the medial side. I'm meant to put medial here. All right, innervation. We're getting into the sciatic world now. In fact, all the other muscles that we're going to talk about, obviously in this video, but in our subsequent videos, are going to be innervated by branches of the sciatic nerve. The sciatic nerve is the largest nerve in the body. But really what it is a collection of two different nerves. You'll have a tibial nerve and a common fibular nerve that are wrapped up together to form the large sciatic nerve. And that they typically are traveling together in this posterior thigh. So if you were to get down to the nerve level, you would be looking at the sciatic nerve. Now, the specific motor fibers that are innervating the hamstrings are almost all going to be tibial nerve or tibial division, okay? So we're getting into already, I do want you to understand that it is the tibial nerve of the sciatic nerve that is going to be innervating this muscle. Sometimes you will just see the hamstrings are going to be innervated by the sciatic nerve, but I do want you to understand that it's a bit more complex than that. The most powerful movement of the hamstrings is going to be flexion of the knee joint, but they will also play a role in terms of extension of the thigh because they do cross the hip joint. Now, we talked about the most powerful extender of the hip joint is going to be the gluteus maximus. But when we're talking about extension that is, say, in walking or just kind of standing still and keeping you upright, it's these hamstrings that are going to play a bigger role in terms of that type of extension of the thigh. All right, excellent. So we got through three of the largest muscle compartments in the whole body. It makes sense. The muscles of the thigh need to be robust. They need to have some powerful actions, but they also play a role in terms of posture and keeping you upright as well. So let's review a concept. We recall that the posterior compartment of the arm and the forearm are innervated by one nerve. You remember me saying over and over again, radial nerve equals posterior. Well, we have a similar pattern in the lower limb. And we introduced it here with the hamstrings. So which nerve is going to equal posterior, as in it innervates the posterior compartments of both the thigh, and this is a preview of the leg as well. So I try to recall what is going to innervate the posterior compartment of the thigh, and that will help you. So pause the video if you need to. And when you're ready, I hope you have landed on tibial nerve. So tibial nerve equals posterior. Tibial nerve is going to be the largest branch of the sciatic nerve, and it will innervate both the posterior thigh muscles as well as the posterior leg muscles. So tibial nerve equals posterior. Obturator nerve is going to innervate the adductor compartment, or that medial compartment of the thigh. Femoral nerve, not correct either. That's going to be the anterior compartment of the thigh. These nerves are not branches of the sciatic nerve. The common fibular nerve is a branch of the sciatic nerve. We haven't talked about what it innervates yet, but it will certainly come up when we get down to the leg muscles. All right, so radial nerve equals posterior when we're talking about the upper limb. Tibial nerve equals posterior when we're talking about the lower limb. And hopefully that helps you kind of compartmentalize those and lessen a little bit of that cognitive burden in terms of memorizing all the muscles and what they innervate, or what they're innervated by, excuse me. All right, excellent. Thanks so much for your time and attention here. I'll see you in the next video where we talk about the muscles of the leg. Thanks.